And welcome. Thanks for joining us on this Monday for our first press briefing of the week. Today, Orange County Mayor Jerry O. Demings will discuss our goals for the week, a common thing that we do at the beginning of each week. We have some exciting news on vaccines. The mayor will also discuss our COVID-19 numbers here in Orange County. He will give an update on CARES funding for individuals and families, a report on our strike teams, and with Christmas quickly approaching, some very good news on the mayor's toy drive. Orlando Mayor Buddy Dyer is here as well with what is taking place in the city of Orlando regarding fighting the virus. He will discuss PPE and some economic rental assistance programs. And of course, we're always thrilled to have Dr. Raul Pino here from the Florida Department of Health here in Orange County on how we are trending with our COVID-19 numbers here in Orange County. We will begin this press conference with Mayor Demings. Mayor?
Good afternoon to all of you. Hopefully you had a good weekend. We come today after the news this past week of the FDA approving the distribution of the COVID-19 vaccine here within America. And you have heard updates from Governor DeSantis about the plan here within the state of Florida. But we are also planning here locally. We have been working very closely with Dr. Pino and our local Department of Health for a secondary distribution plan to distribute a vaccine soon within our community to the assisted living facilities. Dr. Pino will share some general details about that in just a few moments as well. But the nation's first COVID-19 vaccine has arrived in the states, including Florida. This morning, locally, Advent Health will receive 20,000 vaccines tomorrow. To begin administering to frontline healthcare workers, and they are categorized as Phase 1 healthcare employees here within the Tri-Region area or the Tri-County area. That includes Orange County, Osceola, and Seminole counties. Dr. Pino again will talk about some of the future shipments that we anticipate. As our Public Safety Director, Danny Banks, mentioned in our news conference last week, it's important to understand that this will be a long process, and this is not an immediate opportunity for mass vaccination just yet, but in the coming months, we will see mass vaccines being available to our population at large. That's why it's imperative that we continue to mask up, keep our distance, and get tested if we need to, or if we are exposed to someone who has COVID-19. In other words, we're going to be wearing masks and we're going to be social distancing for a while, even though the vaccine is here. So each week, we start the week off and we share with you the goals for the week, and I'm going to do that this week. Of course, our overarching goal is to prevent the spread of the virus within our community, and we have a number of strategies that we have put in place to do so. We will provide transparent updates to educate everyone about the vaccine distribution timeline and keep everyone updated as supplies arrive. Number two, we will continue to offer free COVID testing through Orange County Health Services at Barnett Park. We've been doing that now for several weeks. We will continue through at least the end of the year. We averaged about 1,600 people per day at this site over the past 3 days. Today we had to close the line down at about 2 p.m. to accommodate the cars that were in line at the time. What we are asking is that if there are family units who travel to Barnett Park, please consider traveling in one car. In other words, carpooling, unless there is a reason to do otherwise. Number three, we will offer one final chance for financial assistance to individuals and families through the current CARES Act funding that we have received as a county. Now, I'm going to talk more about that in just a few moments. And lastly, we'll talk today about our strike teams. They continue to inspect and work with Orange County businesses so they are in compliance with the CDC pandemic standards. So let's delve into the numbers a bit now. Since the pandemic began, there has been a total of 64,147 positive COVID-19 cases in Orange County. That is an increase of 2,072 cases from last Thursday, which is the last time we updated you. Our rolling average for the last 14 days positivity rate has been 9.22%. So we're getting closer to that double-digit number at this point. 680 Orange County residents have died as a result of the coronavirus. We do send our deepest condolences to the families and the victims of those who have obviously been impacted by the virus itself. So I still ask, make certain that you protect the vulnerable in our community, those who have various health-related issues, and our senior citizens. Our local CARES dollars must be spent, as a reminder, by December the 30th. That's just a couple of weeks away now, as mandated by the federal government to date. That means your opportunity to apply for our Orange Cares Individual and Family Assistance Program is coming to an end. There will be one last opportunity to apply for the $1,000 that we have been providing for our residents who have been negatively impacted by COVID-19. So mark your calendars. The final online application portal will open on Thursday, December the 17th at 8 a.m., just 3 days from now. We believe will be the final time with this current round of CARES Act funding that will be made available to our residents before the deadline. This is, in fact, the 12th time that we have opened our application portal. The portal will allow 10,000 users into the system. We will allocate approximately $2 million in remaining funding to approved applications in the order they are received. Once the available funding is exhausted, we will hold the remaining approved applications in case additional funds become available before December the 30th. All applicants will be notified of their status no later than the first week of January. This means we cannot guarantee funding for everyone who applies, but we are opening the online application again to ensure we can help as many residents as possible. Our ultimate goal is to not send any money back to the federal government. If you were denied before based on documentation issues, you may reapply. Our team has denied applications for various reasons, but I want to point out the top 5 reasons that applications have been denied. Number one, the COVID impact documents could not be verified or they were illegible. Number 2, the Social Security card was missing or illegible. Number 3, the applicant was not the individual who has been impacted by COVID-19. So the person who applies has to be impacted by COVID-19, as the COVID impact documents must match the applicant. Number 4, residency could not be verified or address information was conflicting. You must be an Orange County resident to apply for Orange County funding. And lastly, the number 5 was documents were illegible or incorrect. You can get information in advance by going to visit ocfl.net/orangecares to read a helpful article about the issues that I just discussed. Again, visit ocfl.net/orangecares. If you have previously applied for the program and have not received an email with your status, you can apply again when the portal opens December the 17th, Thursday, December the 17th. If you have been approved and you were notified of such, please allow up to 30 days for processing and mail delivery of your check. And a little bit about eviction diversion. This Wednesday, December the 16th, is the deadline to apply for our COVID-19 eviction diversion program for landlords and tenants. Applicants must be at least 2 months behind on rent. Landlords can receive up to $4,000 in past due rent. This is a program that both the landlord and tenant must apply for together. So far, 2,273 Orange County families have been able to stay in their homes thanks to the CARES Act monies. Over $7 million, in fact, $7,150,000 have been paid out through the Comptroller's Office to landlords on their tenants' behalf. This weekend, we had an influx of applications. This is partly due to churches who were hosting free information sessions about the program this past weekend. We do want to stress that there is no income cap for this program. So if you are in imminent danger of eviction, please apply. Again, this is if you pay rent, not for ensuing mortgage or foreclosures. Since there's not an income requirement, there is a lot less documents needed to submit your application for this program. Again, the eviction diversion program, the deadline for applying is this Wednesday, December the 16th. You can get information about the program at ocfl.net/eviction diversion. Another issue that many people have asked questions about is our compliance teams, our strike teams, and the work that they have been doing. Our strike teams were out this weekend and revisited some of our downtown Orlando bars and restaurants. I want to say thank you, Mayor Dyer, to the Orlando Police Department for assisting our strike teams on these visits, and I'm happy to report that everything ran smoothly. In total, 17 bars and nightclubs were visited, and 1 warning and 2 citations were issued. To date, our strike teams have visited over 5,800. To be precise, as of just a few minutes ago, they had visited 5,819 businesses with a 98% overall compliance rate. Thank you to our community. Our strike teams will continue to provide guidance, personal protective equipment, and necessary signage on these visits, and also hold businesses in Orange County accountable to ensure our residents are safe. And lastly, let me leave you with a bit of positive news. Because of those of you who are at home, because of the generosity of many of our local Orange County businesses who, I want you to pay attention to what's on the screen behind me, who made donations for this year's Mayor's Toy Drive. We have exceeded all expectations. I'm pleased to share that we received 9,000 toys or more through our online shopping option and in-person drop-off locations this year. That's double the number of gifts that we received last year. And that number will continue to grow as our staff is still counting and sorting gifts that are set to go out to the families this week. Thank you to everyone. I knew that our community would step up to the plate during this holiday season, especially during this time of a pandemic in which our community and our families need us the most. Mayor Buddy Dyer.
Thank you, Mayor Demings, and thank you all for being here today. Today is certainly a day filled with hope, a day we've been waiting for. The first doses of COVID-19 have arrived in Florida, and while we begin to see the sun starting to rise during the start time, we can't let our guard down now. As Mayor Demings said, we must continue taking pandemic precautions like wearing our mask, being diligent about distancing, and we also need to remember who we're trying to protect, who we're taking these actions for. If we're working to stop the spread, we want to protect our families and our friends and our neighbors and ourselves and every person in our community. So the pandemic is still here, but our collective hope is that brighter days are ahead. The City of Orlando continues to assist in protecting businesses and their employees and customers with more PPE distributions. Our downtown ambassadors passed out over 100,000 face masks to our local businesses, thanks to a donation from Orange County government. Also, thanks to the generosity of Orange County government, we were able to distribute another 250,000 face masks to businesses in our Main Street district, Side Drive, Lake Nona, Washington Shores, and Metro West. As the county is, we are continuing to be committed to helping our residents who have been economically impacted by the pandemic. Last week, City Council approved an expansion of our rental assistance program that will allow residents to receive an additional allocation of money from the state to support those in need, and allows the program to cover rent payments not made from March the 1st through December the 31st. You can access that program at cityoforlando.gov. Also, last week, the city approved the application deadline extension for the CRA Small Business Rental Assistance Program to January the 4th. We changed the business operation date to October the 5th to allow more businesses to apply. If you want to apply for that program, go to downtownorlando.com. And finally, speaking of economic vibrancy, last month we joined with the Dr. Phillips Center for the Performing Arts to help them create a new outdoor venue called the Front Yard Festival that allows our community to come together safely to experience live performances. This new venue helps us support our arts and entertainment groups that are some of the hardest hit during the course of this pandemic. And last week, through a partnership with Orange County and United Arts, the City Council approved an additional $70,000 in grant funding to provide financial assistance to local cultural not-for-profits like the Central Florida Community Arts to utilize this new outdoor space and showcase their programming. Thank you. Dr. Pina.
Thank you, Mayor. Thank you, Mayor Demings. As the Mayor mentioned, we have a cumulative number of 64,147 cases. Our recovery rate has decreased a little bit. It's like 90% right now. Our median age is 37 years old, so it's going a little bit older. And unfortunately, we have added 2 deaths to our death roll since we talked to you last week. Those numbers right now are 680 cases that has died, and 2 additional were added. Those are from August, and we have not received any additional death on this month since we talked to you last week. Also, I want to give a little bit of information to the public with regards to vaccination. And first, I want to ask for your patience and understanding as we are going to engage in a logistic nightmare to try to deliver those vaccines to assisted living facilities and other places that need it urgently. So together with the county, we have expressed to the state of Florida that this county is ready, if we are called, to engage in distributing and administering vaccines to long-term care facilities when they become available to do such. And in preparation for that, we have also going to modify our services starting next week. Later on Thursday this week, when we have a press conference, I probably will have more information for you. But some of our services will be either reduced or in some cases closed for a period of time so that we have enough vaccinators in case that we are called to spring into action, which we have expressed our readiness to do so. And we have engaged intensively since last Friday in planning process, even further than we have originally planned to, because we may call into action earlier than expected. As you know, 20,000 vaccines are coming from the Pfizer vaccine into Advent Health for distribution among priority healthcare workers in the Tri-County areas. And they will be also assisting other hospitals, not just Advent Health. We have requested to be part of a pilot program that the state is conducting, and the governor announced it with Broward and Hillsborough counties, and we have asked to be also considered to do so. If we are authorized and considered to do that, we will be engaging in distribution and administration of vaccines to long-term care facilities and emergency providers, but we are working on the initial plans. Also, although there is light at the end of the tunnel for us and for the county, we would like to advise the public that all the CDC guidelines should remain in place even when you are vaccinated. Even when you are vaccinated, you should continue to wear your mask, you should continue to wash your hands and keep your distance. Not only you will have acquired immunity, but it will be very difficult to establish who has vaccinated or who has not been vaccinated. So the best way to protect each other and protect everyone is just to extend this for a little bit more. The public should expect mass campaign vaccinations not before February. And we also have engaged in planning sessions with the Orange County Convention Center to use that site, if necessary, to conduct mass vaccination. And we will always have the ability of do open pads as we have done for testing. All our indicators are up. Hospitalizations are up slightly, but up every day. The same for ICU bed used, and the same for ER visits. Our positivity rate continued to increase daily, and also the 14-day average roll that the mayor have mentioned to you. The only indicator that remains, and we wanted to keep it that way, is the death rate. That remains at the lowest point that we have experienced. But remember, this is an indicator that lags 3 to 4 weeks behind other indicators. So that's why we have insisted that if necessary, we could engage in vaccinations and the long-term care facilities, because we would like to curb those pandemics as soon as we can. There has also been an increase of activity, positive case in long-term care facilities. Not significant, but we are observing it that is starting to move into that direction. With that, I will answer any questions that you may have. Thank you.
Okay, before we go to questions, just as a reminder, if there's any questions for the Spanish-speaking media, we do have translators here who can assist in that process. And we do have some others who have joined us here. We have Mr. Scott Howard from Orange County Public Schools, who's here if there are any questions related to the district. We do have Tim Boldick here with our compliance or strike teams if there are specific questions there. We do have Commissioner Maribel Gomez Cordero, who has joined us here in the audience. And we also have Dr. Yolanda Martinez from Orange County Health Services and Director Danny Banks, our Public Safety Director, if there are questions specifically about our planning efforts related to future distributions here within our county. And I think we have Ms. Diane Arnold somewhere here. There she is in the back. If there are questions about the opening of the portal for the Orange Cares $1,000 grant programs to individuals and families. So with that, we'll open it up for any questions that you may have at this time. And Lauren Seabrook.
Lauren Seabrook, Channel 9. My question's for Dr. Pino. Dr. Pino, can you tell us more about why you all have stepped up and offered to take on these vaccination services from the state? Are you concerned that maybe if the state does it on their own, it might not happen as fast as you guys could do it? Or tell us a little bit more about that decision.
Well, in our particular case, it was really, we are a metro area with a large health department. We have over 60 nurses in our staff, so we can really not sit idle. And if we can multiply the force and provide earlier relief to our county, that's what we are here for. It's not that we doubt that anyone else can do it, it's that we are here on the trenches. We have the resources, the county has resources and has offered support. So if that is the case, we are willing to shuffle our plans, readjust our services, and provide earlier relief. But not in particular any reason. It's just that we are here.
Troy Campbell with Channel 6. This question is for Dr. Pino. On Thursday, you kind of did an all-out call for any licensed clinicians who want to volunteer to help. You just said it is a, quote, logistical nightmare transporting these, and some county services might be closed or paused. What are your biggest concerns going forward with this? Do you feel confident that your department has enough staff on hand to do this? And yeah, your overall concerns and biggest challenges in the week ahead.
So with the Pfizer vaccine, always the first concern is temperature. It have to be really low. So that's always a concern. Although we have the technology and the county has acquired that technology if we need those services. With other vaccines that may come, like Moderna, the temperature is less of an issue because it's a regular temperature that we have enough equipment to sustain those activities. Our nightmare, when I express a logistic nightmares, is that, our county has over 9,000 individuals and employees in long-term care facilities. And the governor's order was to vaccinate all those individuals in 4 weeks. So that's a challenge. And even when you have all the resources, the other challenge that you have is how you distribute the vaccine to all those places. Some places have 4 residents, other places have 300 residents. So the other logistic nightmare is getting consent. Before we administer the vaccine, we have to have consent from each of the individuals. So many people in these facilities, the next in kin is another individual that it may not even be in the county that may release the information. Sometimes it's the facility has the power of attorney for health. So it's complicated from that point of view. When all these issues are resolved, given the vaccine itself, that's not a concern for us. We know how to do that, and we know how to do it well. And we and the county have demonstrated that we can conduct testing at 600, 500 individuals a day. If we were to engage in vaccination of long-term care facilities, healthcare EMS providers, and employees for long-term care facilities, we have to do about a little bit over 500 vaccinations a day, 7 days a week, to meet that goals of 4 weeks. So it is going to be intense.
Amanda Dukes from WESH TV. This is for Dr. Pino. Dr. Pino, we've been getting a lot of calls at our news desk today from people who have pre-existing healthcare conditions but are not in a long-term care facility. However, for them, COVID could potentially be deadly. They want to know where they're going to fall in the order of prioritization for the vaccine. Are you able to comment on that?
Well, I don't have it in front of me. It's quite detailed because even one has 1A, 1B, 1C. So I will bring it next session and make a case of putting up on the screen. Many other individuals will be receiving vaccinations either through the max vaccination that we are going to do, where priority could be given, and also at some point in the future, and near future, because the vaccine production is going to ramp up. It's going to be a little slow at the beginning, but it's going to pick up at a rather fast pace. The dream is that anyone will be able to receive this vaccine at the point of care, meaning with their provider, as you receive regular vaccines, but also, as probably people have heard in the news, CVS and Walgreens will be engaged in those efforts. So the same vaccine, the same way that we get a flu vaccine at CVS and Walgreens, at some point we'll be able to get it for anyone in those facilities as well.
Dr. Pino, one more over here. Dr. Pino. Asher Wildman, Spectrum News 13. Mayor Demings touched on 98% compliance from these businesses. However, the positivity rate now back up to 9.22%. Are your contact tracers finding specific places where it's contributing to the spread? In other words, what are these hotspots, or where are people contracting the coronavirus now, if you have any indicators?
Yeah, home. Home is where it's happening right now at this point. Although we continue to see the numbers in bars and restaurants is less intense. It may have to do with the fact that college-age students are on long break, and we were expecting that this could happen. We could see. And we have seen the largest increase right now was happening between 35 and older. So that indicates that the pandemic is getting a little old, on the older side, which always that at this point. And then the concern is when it jumps into long-term care facilities. But transmission is happening at home. And we have observed this basically mostly with the school-age students who we know are not getting transmitted at the schools because of the large numbers of individuals that we are sending into quarantine. But then many of them convert later on, which is an indication that the transmission may happen among families. And intergenerational living, as we have expressed, it is also a concern.
Dr. Pino, this is Samantha Sosa from Fox 35. So earlier you said that you guys have engaged in planning in case you guys are called into action. So what does that planning look like, in these recent days, knowing that the vaccine was going to, be distributed or announced? And when you guys do get the call, whatever that may look like, what does that look like? I mean, is it the next day that you guys are going to go out to nursing homes? Like, how soon would that be?
Well, I think it's going to be very difficult to justify having a vaccine in storage and not going next day to do it. So we get it today, we will do it tomorrow. The plans are complicated. It goes from storage, safety of the vaccine, also vehicles that you need to distribute the vaccine. Drivers have to be certified drivers by the county to be able to serve you to drive a county vehicle, how you gas those vehicles, how you provide lunch to the staff that are going to go into these facilities, which facility should be targeted first. So that's also developing an order based on number of cases that they have and active outbreaks. And from there is then 28 days later, you have to go over to those facilities again. Getting consent is always a concern because when you do these mass vaccinations, there is little room for going back and vaccinating again because you are moving through facilities, so it's very difficult. If someone changed their mind later, 3 days later, oh, I want a vaccine, it's very difficult to get out of that routine to go back and vaccinate one individual. So there are a lot of concerns. Where you park the vehicles, what is the safety? If there's going to be protesters and demonstrations against vaccination, there is a lot that goes into planning and how to secure. And it goes also from power, as simple as we have to have a generator in place so that the power goes out for any reason, the vaccines are safe. So it's a lot of little things that have to be planned. What's that? Well, not done, because it's something that we do, we do all the time, but we are in the process, which will be done by Friday.
Doctor Pino, Michelle Félix, Telemundo 31. Mi pregunta es la siguiente. Sabemos que la vacuna Pfizer se debe tratar en 2 fases, en 2 dosis. ¿Qué les puede decir a las personas? Que muchas personas pueden pensar, bueno, ya me puso la vacuna, estoy bien, no me va a pasar nada, no me puede dar el virus. ¿Qué más o menos nos podemos decir en realidad para aclararle a muchas personas que creen que ya con la primera dosis estarían bien?
Bueno, mira, la realidad es que, ¿sabes? El cuerpo tiene 2 tipos de inmunidad. Una inmunidad de corto tiempo y una inmunidad de más largo tiempo. La que es permanente y la que es. Cuando uno adquiere una enfermedad, el cuerpo inmediatamente te da una inmunidad primaria que vive muy poco, tiene muy poca duración y entonces te da la otra que vive más. Lo que se está buscando cuando tú das una segunda dosis es porque se determinó que en una primera dosis no era suficiente el tipo de inmunidad adquirida. Y entonces tú le das una segunda, que es lo que se llama un booster. Y entonces esa de verdad le dice al organismo, produce inmunidad de manera permanente. So the question was, why do I have to say to people who may take one dosage and say, hey, I had the vaccine, so I'm fine now. So both vaccines, Moderna and Pfizer, have 2 dosage. Estoy repitiendo en... So both vaccines have 2 dosages. And the idea is that, the body always, when you get exposed to a disease, your immunity has 2 types of immunity, short-term and long-term. And you can think about like memory. It's the memory of your immune system to recognize these microorganisms. So Sometimes the first dosage is not enough to give you a long-term immunity, and that's why this booster is given. So it was determined in this case of the vaccine through the studies that that second booster is needed to give you a permanent immunity. Now, just to clarify, we don't know yet how long this immunity will last. This is a new disease, so progress and time will indicate how safe we are, and this is going to be a yearly vaccination like the flu, or is something more lasting. That's the part that we don't know yet.
Okay, wanted to give Dr. Pino a break. This question is for Mayor Demings. All right, so Melissa Thomas of Florida National News. Question with regards to the two businesses that have received the citations. I know there was last week that sort of back and forth conversation with the governor not requiring businesses to get fined, while you were saying, as the Orange County mayor and of course the emergency administrator, the person that manages in a state of emergency, that you can. So I wanted to find out, have you heard anything from the state or have received any pushback from the state with regards to the two citations that you've already given out with the businesses that violated?
We have not received any pushback from the state. I think primarily because we believe that we were operating consistent with the executive order that the governor issued. So we'll go forward. Thank you. I will point out something that Dr. Pino said. He said to all of us, in terms of mass distributions, don't count on that until sometime February or thereafter. That means that we still got to live with the virus. So we're going to be wearing masks and doing these other things for quite some time. And even once the mass distributions occur, it's going to take a while to get 75 to 80% of our population vaccinated. Orange County alone is 1.4 million people here within the region. So it's going to take a considerable period of time.
This is Steve Hudek from the Sentinel. This is for Dr. Pino. Dr. Pino, hospitals today said that they are up almost double in hospitalizations than they were in September. Now, it's still a far cry from what we had in July and June. But what do you think we're seeing? Are we seeing Thanksgiving, the results of Thanksgiving? And the hospitals right now are saying, we've got it under control, but should we be concerned?
Yes and no. I mean, we have very large health systems in our county, and this morning were over 1,000 beds open in the county, about 144 ventilators, about 144 ICU beds, 628 ventilators. So, we have the resources. The question with this pandemic is that, again, you have today 20 cases, you go to bed with 20 cases, you wake up tomorrow and you have 100. And then next day you have 500. And then when it goes wild is when we get concerned about utilization of resources in healthcare systems. Now, as the pandemic gets into the older side of the population, you are more likely to see an increase in hospitalizations, and you are more likely to see an increase in ICU beds. And we are seeing that. There were 38 people in ICU beds for COVID-19 last night. And that number, you should expect statistically around the nation, about 50% of the people who are in ICU beds for COVID-19 could die. That's the mortality rate for COVID-19 in ICU beds, and that's high. That's high by any standard. So that's the concern. The county and the hospitals have the resources to manage, but as the pandemic gets older, those are going to be the utilization of healthcare services are going to be higher. Because whereas in the younger population, we have expressed about 25% of those are asymptomatic, so they don't experience anything. And many of the young elements of the population, when experience symptoms, for the most part, they are very mild. So they don't utilize healthcare at the same rate for COVID-19 than the older population.
For Dr. Pino, Pete Reinwald, digital reporter, Spectrum News 13. Could you elaborate and discuss any concerns that you have, particularly about seniors who might be reluctant to take that second shot after they show some symptoms? And if it's possible, are there any possible strategies in place to get them to take the second shot if they're reluctant? Thank you.
Yes, a lot of public messaging. A lot of us who are leading the faces of the pandemic may be taking the vaccine in public, about to giving people the sense of security that they need. I think the fact that healthcare providers are going to go first is going to give some level of confidence to people. I mean, these are the people who know the body, who know the systems, who know vaccine, and they are taking it. So the vaccine is safe. The data has been analyzed by independent bodies. And I know that everything has been politicized, but it's critical, important to take this vaccine because we need to be able to achieve immunity of the herd with this vaccine, we have to get to about 79% of any population vaccinated. And in our county, that's close to 1 million people. It's close to 900,000 people. So those are significant numbers. And it's going to take us a little bit to get to those levels. Probably we'll not be able to vaccinate that number of people until probably early in the summer. It's probably what we get to those numbers. So with that, if we are giving this chance and opportunity to give hope to seniors and to those who are affected by pre-existing conditions, take the vaccine, it is safe.
This next question was texted in from Mike Steinen with Florida Daily. This is for Mayor Demings or the strike teams. His question reads, with businesses now fully aware that fines are on the table, did the strike teams find any difference in attitude from owners and patrons of the places they visited this weekend? And if so, what was that difference?
Yeah, I think with the incentive of fines, people adjust their behaviors. But I'll ask Tim Bode to come up and talk to that.
Yeah, I think from the weekend, I think one of the good things that happened prior to this weekend is we had a lot of the businesses that we visited. There were several that asked for a courtesy visit from our strike team to kind of get them an idea of what they would need to do to be in compliance and so forth. So that worked out really well because several of those were in compliance at that time. Really, the overall feeling from a lot of the bar owners and managers there was very open and honest, appreciated what we were there to do, which is a big reason why we're out there, is to help them, encourage them, and educate them in what they can do to come in compliance. Overall, very smooth weekend and turned out really well from that standpoint.
Thank you. This next question is from Mayor Demings from Lara Greenberg with Fox 35. Mayor Demings, her question reads that you mentioned last week that they're looking at the convention center as a possible mass vaccination site. I also read a report that UCF is being considered for a mass vaccination site. Can you confirm that? We've also read reports about the possibilities of malls or department stores being used for these sites as well. Can Mayor Demings or Dr. Pino talk about what other locations they're considering for this and any details on how these mass vaccination sites may work?
What I can confirm is that the Orange County Convention Center has been reviewed as a potential mass vaccination site by the Florida Department of Health. Dr. Pino and his team have visited the site along with our staff assigned to the convention center. We're looking at all options, I think, as we move forward in order to be geographically located to where the need is. It won't be a bad thing to have multiple sites where people can be vaccinated. Of course, the state is working in partnership with some private providers, CVS and Walgreens, and those conversations are ongoing, I believe. And so as we get closer to the time where we have the availability of the various types of vaccines that will be available, then there will be an additional demand for healthcare workers to administer the vaccine itself. And so that's what we're planning for. That's why our team here between Orange County Health Services, the Orange County Health Department, and the private healthcare partners are having those conversations about how do we collectively ramp up to be able to meet the need, as Dr. Pino pointed out, to get to that point where we have herd immunity. It will require 79%, I heard him say, of our population that would need to be vaccinated. And so that takes coordination. So we have plans of action there. As far as UCF, I can't confirm that. I haven't been involved in that. I don't know, Dr. Pino or Danny Banks, if you all can confirm that about UCF or not.
So UCF has always been considered. We have existing memorandum of agreement with large facilities for what they call pods, point of dispense, and UCF is one of those facilities. So it will not be out of the realm of possibilities because they have a large body of students to do a vaccination pod there.
Thank you. And these final two are for you, Dr. Pino. Ryan Lynch with the Orlando Business Journal. Dr. Pino, when looking at vaccine totals like Advent Health, does that take into account both doses or a 2-dose vaccine?
So the numbers that you are seeing, for example, let's say Advent Health is receiving 20,000 dosage. Those are the first 20,000. The other 20,000 will come for the second dosage of those individuals. So it's one dosage, first dosage, not 10,000 people, 20,000 people.
Thank you for that clarification. And lastly, from Emily Speck with WKMG, Dr. Pino, can you talk more about the pilot program Orange County has volunteered for? This is in regard to the long-term care facility vaccine that you mentioned in the same breath as Broward and Hillsborough.
So I don't have the details how Hillsborough or Broward are doing it. In our case, the way that we are planning, it will have to be approved by the state if we go to that level, is that vaccines will be stored by the health department. If it's not the Pfizer, the county has the capacity to manage the Pfizer vaccine because they acquired equipment for the county in case that comes that way. UCF, by the way, also have capacity for the Pfizer vaccine for the refrigeration in the research department. So with that, probably what would happen is that teams of vaccinators will leave from a location in downtown to predetermined facilities. Well, they will conduct vaccine from room to room in the case of assisted living facilities. And also, all EMS providers are going to be being training this week. We have 2 sessions this week already planned on how to administer vaccines on behalf of the health department. And in that phase also, EMS services provided will be considered as well in receiving the vaccination if we get to that phase together.
Okay, I think that concludes the questions. Thank you all for being here. We will come back on Thursday, and in between now and then, we will endeavor to keep you updated about the distribution of the novel coronavirus vaccine within our community. Thank you.